9 signs and symptoms of breast cancer that you should know about. If you're new here, welcome to Health Corner. I am Dr. Shalom T, and my goal is to build awareness to different health concepts so you can identify diseases early on and you can make better health choices every day. Please subscribe and turn on post notifications so you don't miss out on any updates. Let's get right into it. Here are some symptoms that can help you quickly recognize breast cancer. The first thing you may notice is a lump or mass in the breast. So on examination, if you feel like, there's like nodules, it feels hard, sometimes it can be painful, other times it's not painful. Majority of the times, it is not painful. So if you do notice a lump or a mass, that could be a sign. If you notice a change in the breast shape or size, so you realize that the breast is kind of looking irregular, or there has been an increase in the size of one breast compared to the other, that could be a sign as well. If you notice nipple discharge and you're not breastfeeding, any other discharge aside breast milk, right, that could be a sign. Most of the time the discharge is bloody, sometimes it can be watery. Any discharge aside breast milk in a non-breastfeeding woman is a red flag. If you notice a change in skin color, that could be a sign. There's something that we call peau d'orange. You see like how an orange, the back of an orange looks like, and they're like pores. So if you notice that there's a change in the skin color and the skin texture, and you're noticing most of those pores, or the skin is starting to look darker than normal, that could be a sign. If you notice that there is pulling in or dimpling in the skin surrounding the breast, so you know how like you have dimples and when you smile it pulls in. If you notice that there's pulling in the breast tissue, that could be a sign. If you notice that your nipples become inverted, for women who have nipples that are inverted, that's pointing nipples, you notice that the nipple just suddenly is like pulling in and it folds in, that could be a sign that you want to look out for. If you notice that you have breast or nipple pain, it is not always linked to breast cancer, but if you're starting to feel uncomfortable with it and you feel like it's a call for concern, you have to check that out. If you also notice crusting or flakiness around the nipple, so it's like breadcrumbs, or you feel, like when a bone is cracked and it's starting to dry, just crustiness and flakiness, that could be a sign. And then finally, if you notice lump-like feelings in your armpit, so it's like nodules, and you realize that there's inflammation going on in your armpit area, you might want to check that out because it could be inflamed lymph nodes, and sometimes you can also find them below your collarbone. These symptoms don't always mean breast cancer, but they are health red flags because normally they should not be happening in women. Anything that goes outside of the normal is something that you may want to go and get it checked. Please, early diagnosis is key in the management of breast cancer. You want us to find this out early. So do not hesitate to talk to your doctor, to go out there and consult. I know that the line at the doctor's office is really, really long, but this is important. If you notice any change, do well to consult your doctor so that you can start treatment, or the root cause of it, even if it's not breast cancer, can be diagnosed early on. Also, if you're a man watching this right now and you have noticed any of these symptoms, go and talk to your doctor, because don't be surprised, breast cancer can occur in men as well. So don't sit there and say, oh hey, I've been feeling this. No, go talk to your doctor. If you have any questions, please leave them down in the comment section. Like and share this video to someone that may need to see it. Don't forget to subscribe and turn on post notifications so you don't miss out on any updates that come from us. If you haven't watched the video where I talk about some high risk factors for breast cancer in women and what you need to do if you do feel like you're at high risk for this disease, do well to watch it. I'm going to link it on this video or put it somewhere down in the comments or in the description box. Thank you so much for watching. I'll see you in my next episode. Bye-bye.